Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance. And as a practicing chiropractor of starting my 24th year, I have seen more than my share of low back pain cases, both acute, for people practically get or actually have gotten carried into my office, and chronic, of people who have been dealing with the same crap for years. And in general, we do pretty well with them. I'd be lying if I said we fixed everybody, but the vast majority of people that come to our office have a benefit, whatever condition they come in for. Now, one of the things that's different different in the way we practice, is highlighted in this particular study. And it has everything to do with the muscles and the trigger points. And anybody who knows me or has been in the office as a patient knows that we hang our hats on treating the soft tissues, the muscles, the ligaments, the tendons, the fascia, all of those tissues that play a role in any type of pain, including low back pain, both acute and chronic. And in this particular study, researchers took 48 males, and they looked for trigger points. Most people have heard of trigger points, like knots in the muscles. It's a little bit more complex than that, but we can have latent or active ones. Active ones are trigger points where you press on them, you can feel that referral pattern somewhere else other than where we're pressing on them. But latent are just the knots in there that affect the function of the muscle. And they found that when they looked for these latent trigger points in the dominant glute medius, so it's a muscle that helps control hip motion, but also plays a large role in back pain, that the participants that had latent trigger points in their dominant glute medius had more weakness in that muscle and more strength in the opposing muscle group. So you're talking about building in an imbalance. And that totally makes sense from what I see in the practice. One of the reasons I'm holding this little ditty right here, this particular instrument is called Graston. Some people would refer to it as like an instrument-assisted soft tissue manipulation, but these play a huge role in managing any type of musculoskeletal injury, from acute to, oh my gosh, I've had this pain for 20 years. And I've found that any chronic low back pain patient, we have to address what's going on in the glutes. If you took these away from me and handicapped me with just using adjustments or even exercises, I would not feel nearly as competent treating those cases as I can when I can address the soft tissue. One of the things, and this flies in the face of the whole core concept. We have to manage different, I have to build up my core, I have a weak core, and yet that whole concept of core doesn't really hold up very well in the literature. So people with poor cores may not have low back pain, and people may spend years working on their core and not change their back pain status. And that is because no amount of strengthening or stretching is really going to manage those knots in the muscles, those fascial, whether you're talking about the muscles or the knots in the muscles or restrictions in the fascia around there. No amount of exercise, adjusting, or strengthening is going to change those. And that's why I think that the core concept really doesn't always play a big role. Maybe if you combine it with some aggressive soft tissue work, but for me, I always feel that life is rehab enough. If we can get everything moving the way it's supposed to, then you're going to see that that going out and moving, doing things like yoga and racquetball and jogging and hiking are going to be enough rehab for the low back. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs information, and subscribe to the channel.